80146, your SMS line at Metropole TVKE across all your social media platforms. Welcome to your official economic review this morning. Now, the government has extended the ongoing 8 p.m. to 4 a.m. curfew in Nairobi, Kiambu, Kajiado, Machakos, and Nakuru counties to the 29th of May. In a special Gazette notice, Interior Cabinet Secretary Dr. Fred Matiang'i said the 10 p.m. to 4 a.m. curfew for the rest of the country will also remain in place for the next 2 months. On March 26, President Uhuru Kenyatta announced a partial lockdown in the counties of Nairobi, Kajiado, Kiambu, Machakos, and Nakuru to contain the surging numbers of COVID-19. In the public order number 2 of 2021, the CS says there shall be no public gatherings, processions, or movement either alone or as a group during the period of the curfew except with the police permission. As before, essential service providers have been exempted from movement restrictions. This morning, to help us understand exactly where we are as regards the curfew and its efficacy in understanding the COVID-19 dynamics, we are joined by Reginald Kazutsu and also Dr. Victor Ngani, who is the Medical Director, RFH Healthcare. Let me start with you, Reginald. This is coming at a time when the CBK has released a study showing that business managers are saying that they're not really concerned about the COVID-19 curfew and containment measures. What they're really concerned about is the cost of doing business as an implication to the COVID-19 containment measures. Reginald, it's an extension. It now looks a bit definite because the first time that we had the president speak, it was a bit indefinite. Talk to me. It's an extension, but then we're saying, well, there's nothing that follows that in any sort of economic package or any sort of economic alleviation that we saw in the first lockdown. Are we calling too much for the government?
Morning, Simba.
Good morning.
I think in terms of getting an economic package in place for this duration, one, the time frame is not that long.
Yes.
By the time they craft anything, the 29th of May will have already reached. By the time they take anything to Parliament to be approved and all, by 29th of May will have already reached. So the period that has been put is not a long period that they can put. Unlike last year, when they knew this is most probably going to last for the whole year,
yes,
what they are going to do. So they had enough time to put in measures and do that. If you look at the administration of just trying to say, okay, let's give people waiver for this 1 month income of the income that they've earned in March or April, the administration of that will outweigh the cost. It will outweigh the benefit. The cost of it will outweigh the benefit of trying to just give that incentive. Number one. Number two, knowing how people are, if I know I have an incentive for the month of March, I will upload all my revenue to be in that month of March. So I think on the element of time, the government does not have time to craft anything and to give anything that will be done. Look at even the US.
Yes.
It took nearly 3 months, 4 months for Biden to get his first checks relief to come out, and they are more efficient than us, so to speak. Secondly, apart from just the time frame, the government doesn't have the resources to do that. Anytime we ask the government to do any incentive, we need to know that the government generates revenue through 2 ways, either taxation or borrowing. And Kenyans are not liking both. They don't want to be taxed, they don't want the government to borrow. But at the same time, we want the government to give incentives. So I think at this point, we can't borrow, we can't tax, and we can't give incentive. I think the issue is they might have rushed to remove the incentives that were there in 2020. Those should have been extended until the economy recovers. But by removing them in January, that was a statement of saying the economy has recovered, we are back to normal, which is where I think the misdemeanor and mistake was.
Pretty much. All right, let me bring in Dr. Ngani Victor. Let's understand, Dr. Victor Ngani. I mean, I just want us to look at exactly what has transpired since we locked the five counties. We've never gotten to a single-digit positivity rate, not yet. Because even if you look at the last 24 hours, we are still at 18.3% positivity rate. When do we expect that these curfews that are at 8 p.m. and then the lockdown of the 5 hotspots that were identified by the Ministry of Health, that are going to, I would say, act up?
Thank you, Simban. Good morning.
Good morning.
I think the initial discussions we had, if you remember last year, we had this very question as to whether the curfews work and whether these measures have some effect.
Yes.
And whereas the impact on the positivity rate hasn't been as big, I must tell you that where we are in the hospitals, there is a little bit of relief. About 4 weeks ago, it was impossible to get a single bed. We had queues of over 10 patients waiting for an ICU bed that was basically not there. And so many patients were not making it just because they couldn't get a bed. We had many people looking for oxygen beds, isolation beds, and they couldn't find it. And so in the last 1.5 weeks approximately, we are seeing a slight easing, not by much, but slight to the point where if you need a bed, then maybe within a day or two, you'll get the bed. And that's a big improvement from where we were. In fact, our fear earlier on was that a situation was happening where many patients will need ICU beds that are just not there. And to some degree, I think over the last 1 year, we have come to the conclusion that these measures from the ministry, they do work. Not just the curfew, but also the closure of bars, closure of social gatherings, and so on. The impact is definitely felt on the ground.
Yes.
Of course, it was done a bit too late, and so we still have a bit of spread in the community.
Pretty much. All right. Now, Reginald, you hear exactly what Dr. Victor Ngani is saying, but well, that despite the positivity rate still recording high numbers, we do expect that, well, these containment measures are going to work, which is exactly what we're showing you, exactly where we are in terms of what was our quarter by quarter GDP growth. Reginald, how much of an impact is the second closure going to have on the economy, with majority of those business managers interviewed by CBK saying, well, we expected quarter 1 of 2021 was going to be the rebound. They've pushed it forward to quarter 2 of 2021. But we're already in quarter 2 of 2021, Reginald. Are we procrastinating what our economy numbers are going to be at the end of the year? And if so, then why are we still riding on with these closures of the economy?
As Dr. Victor has said, ideally, lockdown, even WHO has come out and has pronounced that the purpose of a lockdown is to give you time to sort out your infrastructure, to give you time to sort out your capacity.
Yes.
In Kenya, we seem to use lockdown to stop the spread of the virus, which WHO has not said that is possible in terms of locking down actually stops the spread of the virus. It's supposed to buy you time so that you don't get overwhelmed, you increase your capacity. We locked down the whole of 2020. We increased the no capacity. We had a third wave that started, and within a week our hospitals were full, ICU was full, oxygen was missing, and I'm thinking, so what were we locking down for 2024 if we did not actually spend any money to improve the capacity? Because then what the government is saying is that if we have a fourth wave, we are going to lock down again. If we have a fifth wave, we'll lock down again. And we are missing the point of locking down. The locking down is to, one, buy you time. The virus will still spread. It's still going to spread in Nairobi. It's still going to spread in Nakuru. It's still going to spread. When you open, those people will travel. It will still go spread to the counties. The county governors came out and complained about the rising number of COVID cases in the counties which are not part of the red zones. So then you ask, so clearly it was not about people in the red zone going to the other counties, but it's still increasing in those other areas. And I think that's where the government needs to understand this element of lockdown and increase capacity. In terms of GDP numbers, definitely to be affected. Quarter one is going to be affected because they locked down in March.
Yes.
So that was March gone. So that means we expect retail numbers to perform dismally, private consumption to perform dismally. So you look at things like restaurants, the hotel and the tourism sector, and all will definitely get a hit. might not affect so much, but since it was the end of March. But the beginning of Q2, which is April, and especially for the tourism, hotel sector, restaurant sector, transport sector, where people are traveling during Easter, people are going for holiday, merrymaking, that boom that comes at the beginning of Q2 has literally been sidelined and moved down the side. Banks seemed like they were recovering in terms of non-performing loans. I think some people that were paying may now say, okay, I can't pay because this is happening, and this time there's no incentive of saying don't report this person to Credit Reference Bureau, don't categorize this as a non-performing loan. So that will also have a ripple effect on the banking sector. But I think the government was in a space where you reach a point where you realize the economy is gone. The truth of the matter, these stories of rebound in 2021 were just hogwash. There was not going to be no rebound in 2021. They were just going to recover from a very low base. Why? Because education was closed down, education is open. So yes, we'll get a 20-30% gain in education, but the economy is actually not not grown. So the government had a choice. Do we try to continue to recover an economy which is literally gone, even for 2021, or do we add the health crisis to the problem? So they took the lesser of the two. Let's keep the economic problem that we already have, but let's not add a health crisis. Was the rate where we were going to have a serious health crisis. So that's why they decided to lock down.
Yes.
The economy, yes, we have ways of growing the economy afterwards if we have the right leadership, right strategy, and right policies. But as we stand, I don't see a huge economic growth coming in 2021 in absolute terms.
Pretty much. Just before I bring in Dr. Ngani Victor, just to tell us exactly which is the magic number that we're looking for out of this curfew and lockdowns. Reginald, I just want us to look at exactly what has been the trend of a credit to the private sector in the economy throughout this entire period of COVID-19. You can actually say that all the way up to Q4, yes, has been low, but rising. Reginald, how do we interpret that data, that despite us talking about how the COVID-19 pandemic has really shook the economy, well, credit in the private sector has somewhat sort of, I would say, become, well, on a rising trend. And I want to ask you this, is that sentiment going to change now, since we're starting 2021, and the same exposed businesses that were leading in terms of the default ratio that we're seeing in the banking industry are the ones that have been exposed now? Is that going to change as from Q2 and Q3 of 2021?
I think we need to look at those numbers with a bit of pinch of salt, because do we say credit expanded because they issued out new loans, or do we say credit expanded because they restructured loans? Because we can't say that credit was expanding at the same time where they restructured 54% of the total loan book of the country.
Yes.
So are we saying that they restructured 54% and issued new loans during the same period? Which sectors did they issue the loans to? Did they issue the loans to the hotel sector and whatever at preferential rates as the government wanted? Did those loans go to actually increase the investment in the economy? Who has expanded in 2020? Who has said, I've increased my capacity, my factory capacity, I have hired more people? So the question is, where are these loans going? Are these loans just someone going to Stanchart getting a loan to go repay a Barclays Bank or an Absa Bank of Kenya loan? Was the effect of that is that, yes, loans have increased and the repayment at Absa has reduced. But in terms of the economic effect, we're at a nil, because we cannot expand private credit and there is no commensurate growth in employment. There's no commensurate growth in the national savings or investment number. And there is no impact on GDP itself in terms of output. So the question is then, where did that money go to? And my own feeling, I've not looked at the numbers properly, but mostly there is the restructuring effect that came in. Because when you restructure your loan, it's as good as a new loan. Because it's like they repay that loan, issue you another loan on different terms and conditions. Are we counting that as a new loan? So we need to look at those numbers with a pinch of salt.
Dr. Victor Ngani, come back to the conversation therefore. I mean, we are on an extension. We do know now it's a bit definite. We're waiting all the way up to May 14th. Which is the sweet number that the Ministry of Health is looking for? We know that we're supposed to go to a single-digit positivity rate. But Dr. Victor Ngani, which one?
Simba, I'll say then the number, which is a magic number, I'll put that in quotes, is a positivity rate of 5 and below.
Yes.
But then the issue is not really that positivity rate. It's the question of severe and critical disease. And then the second one is overwhelming the health systems. And as has been correctly said, we are looking for a situation where, number one, the number of people who require these services does not exceed and does not overwhelm the capacity that we have.
Yes.
And that's why the concept of increasing capacity is super important. We've lost a whole year, but now we've been jolted back. I think when I say we, I mean the government could have done much better. The governments, actually, we could have done much better in terms of creating capacity, especially critical care capacity. But more importantly, there is the concept of preventing deaths, because gaining access to an ICU is not a guarantee for a good outcome. Right now, we've had a lot said about ventilators, but the mortality rate on ventilator is almost 50%, sometimes higher. And if there's no experience, it could even be closer to 90%. We are seeing many facilities that don't have experience in using ventilators, placing them there. And with that, then it's almost a 90-95% mortality rate, because the use of ventilator is not as simple as ABC. And so we are looking to prevent those who are at risk of death from contracting COVID-19 and getting them to a point of getting critical and severe disease.
Pretty much. Now, let's move on to the next one this morning. Well, the Ministry of Labour now plans to have...
How we do this is vaccination or immunity that will protect these individuals. And now there's real hope. We have seen countries that are vaccinated to a big extent. They're able to reduce their spread in community by multiple times. And we hope we can achieve the same for Kenya.
Pretty much. Let's move on to the next one this morning, where the Ministry of Labour now plans to have part of the 257 billion shillings loan facility from the International Monetary Fund to cushion workers involuntarily who lost their jobs as a result of the pandemic in form of a monthly stipend. Labour Cabinet Secretary Simon Chelagui indicated to the National Assembly's Labour Committee that they were in the process of negotiating with the Treasury on the amount to be disbursed to the ministry to cushion workers who lost their jobs in the 5 counties as a result of the lockdown. And the ministry is concerned that the newly introduced wave of new curbs will further see more job losses and pay cuts across different sectors and industries in the country, similar to what was witnessed last year during the first wave of the pandemic. Almost 1.27 million workers lost jobs in 3 months to June when Kenya imposed stringent coronavirus containment measures that led to layoffs and pay cuts. The Treasury earlier revealed in its post-COVID-19 recovery blueprint that it was working on a plan to create an unemployment insurance fund, to give short-term relief to workers who lost their jobs or are unable to work due to illness, which will see employees contribute 1% of their pay that will be matched up by employers towards the fund that aims to generate at least 23 billion shillings annually on implementation. Reginald, before we cross over to that area, let's look at exactly what the COVID-19 pandemic has done to the Q3 unemployment numbers within the country that we're talking about this morning. And we are saying that's a strict definition of people who lost their jobs or were unemployed in Q3 for more than 4 weeks, which if you go to the next definition again, which is a very strict definition, you will see by numbers on those cohorts as well that indeed, yes, the same numbers that we're talking about there, you can actually, the biggest cohort, 20 to 24, 442,936 are the ones that were leading in terms of unemployment within the country. Reginald, how feasible is this plan by the Labour Department?
It's what we call wishful thinking, waving magic wands and all those. They don't have the infrastructure or the capacity to do what they are talking of.
Yes.
If you cannot even produce or administer, what is it called, Huduma numbers or all those things, how are you going to get spending checks to everyone? Are you going to do it through M-Pesa? How do you know who actually lost their job, who did not lose their job? As in, I don't think they have capacity to do that. That's number one. And number two, IMF money is not coming to do some of the things that people are thinking is going to come. IMF money is coming to help Kenya with their external balance of payments, which is to help repay foreign denominated loans. Because Kenya has a huge dollar funding gap, which let's say the truth as it is. Kenya cannot pay its external debt without borrowing.
Yes.
Completely. Our exports have been flat at $6 billion for the last 8-10 years. Our imports are around 18 to 19 billion dollars. That's 1:3 for every export you get. Even if you add this mysterious magical diaspora remittance number of 2 billion a year, that just reaches 8 billion in terms of dollar inflows. The tourism sector is dead. The government has a funding gap of $10 billion. Yeah. So when the IMF brings some money to come, it's just to help Kenya not default on their loans. I don't think they will divert that money to go and do spend-its, one,
yes.
which they do not have capacity to do. And how sustainable is it? Okay, so you give spend-its for 1 month. Where are you going to get the money to do the spend-its for the next month? If you start saying people contribute 1% to an unemployment fund, and the employer matches 1%. In essence, you've just increased my taxation, because I don't have access to that money unless I get unemployed. Unless they tell me that at the time I'm retiring, I can get access to everything that I've contributed to that fund as part of my retirement, makes sense. But if it's just contributing and that's it, if I don't use it, gone, you're going to have the same fight that people were having on the housing one, where people went to court and said, I'm not going to pay for a house which I don't have access to actually be able to buy it myself.
Yes.
So it will end up in court, it will be a fight, it will be a battle, and it won't be implemented.
Reginald, but is there a need within the economy to really think about how we can cushion some of the members of the working force within the country that have lost their jobs as a result of the second closure? Is there a need within the economy?
It is a need, but it is a need that we cannot afford. I need a Mercedes-Benz, but I cannot afford it.
Yes.
So I'm not going to get a loan to just buy a Mercedes-Benz because I need a Mercedes-Benz maybe to get a deal or two. It is a need. People need to be cushioned. But the truth of the matter is we have to get into a tough time as a country.
Yes.
There are things that we will not be able to do because purely we cannot afford to do them. Unless the government says that they're going to print money. If they print money, inflation is going to go up. So the same people you are helping, you are killing them on the other side by printing money. If they decide they want to do this and they need to increase taxation or borrow more, we are still in a situation that is a mess. So as a country, we just need to come and say we have messed up in the last 10 years. We need to sort out this mess. It is going to be painful for the next 3 or 4 years. But some of these ideas and solutions are not feasible at the stage where the country is financially and economically.
Reginald, let's take a little break, because once we come back, you're saying that, well, under that blueprint for the post-coronavirus recovery plan from Treasury that wanted to see Kenyans pay 1% unemployment tax, you're saying it can be implemented. But people like to think otherwise. Once we come from this break, Reginald, you can actually get involved. 20146, your SMS line at Metropole TVKE across all your social media platforms. #business.